Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Colin Ayers, Educator and Planner with the Sueur, Waseca County in Minnesota. Colin graduated from New to Public Health in January 2023. Colin, thank you so much for being with us today. Can you please tell us a bit more about your role and why you got into the field of public health?
Yeah, thanks, Juliana, for having me on today. Every day, my role as a public health educator and planner, honestly, is a little different. No 2 days are exactly the same, and that's what keeps things very interesting and exciting. When I first stepped into this position, my focus was largely on data collection and analysis for a variety of projects. These projects included everything from our community health assessment and our community health improvement plan to quality improvement projects, infectious disease data tracking, community surveys, and a few other grant-funded initiatives. Now, I've also taken on the role as project leads for areas like mental health and communications, which definitely adds a new and rewarding layer to my work. How I ended up in public health is actually kind of a funny story. My original plan out of college was to work in a hospital setting, but when I started sending out applications, my aunt actually suggested I look into public health. I read through the job posting, decided to apply. Honestly, it turned out to be one of the best decisions I've ever made. What makes this role even more meaningful is that I was born and raised in the very counties that I serve. Growing up, I built strong connections through my family, friends, sports, extracurricular activities, and now I get to use my education and skill to give back to the people that helped shape me. So it's pretty cool, in my opinion, to walk in the office every day knowing that the work I'm doing impacts those family, friends, neighbors that influenced me when I was very young.
I have goosebumps, Colin. That's such a powerful story, and it's really inspiring to hear how your personal connection to the community drives your work. What advice would you give someone interested in pursuing a career in public health? Maybe it's someone that is thinking about it, or kind of like you that didn't really know public health was an option until someone tapped them on the shoulder and told them about it.
Yeah, to get in the field of public health or just be a public health educator and planner, I'd say one of the biggest things is just be a learner. Public health projects often deal with new or emerging information, and in many cases, there might not be a lot of experience in the counties that you serve, but that's perfectly fine. Um, Lean on some of your research skills, stay curious, be ready to adapt to these projects. Secondly, I would suggest learn to work as a team. Public health is all about improving community health, and that means partnering with others. Collaboration is essential to getting things done. So if you can find a way to be a team player, that's huge. Thirdly, I'd say connect with as many people as possible. Take the time to set up introduction meetings with community partners. The more you engage, the better they know who you are. And when a project or an opportunity arises, they'll think of you, and those connections will pay off in the future. Next, I would say keep a daily to-do list. If you use a calendar, sticky notes, or some other digital tool, just stay organized. That's key. Some projects move quickly while others take their time. So tracking your progress will often help you stay on task. And I personally like to use the sticky notes because it's rewarding to cross things off the list. And lastly, finally, just have fun with it. Public health is often about long-term results. You might not see the full impact of your results for years, but when you know you're making a difference for your community, it's absolutely worth it. So just to recap, I'd say be a learner, learn to work as a team, connect with as many people as possible, create a daily to-do list, and have fun with it.
That is fantastic advice, Colin. It's clear that building relationships and staying curious can open a lot of doors in public health, and especially that organization piece. It sounds like you do a lot of variety of work, which can be really rewarding. So having that organization system that works for you will help you feel organized and keep everything moving along. So, as we wrap up, I just want to thank you so much for sharing your story and a little bit more about your role as an educator and planner and all of those important insights that you shared with us today. Your journey specifically is a great reminder of how passion and personal connection can lead to really meaningful work and joy in what you do. So, thank you again for joining us, Colin.
Thank you for listening to Field Notes, Insights from N2PH Health Alumni. For more information, visit new2publichealth.wisc.edu.